Starting next week, Los Angeles County and others around California will have to prove they're paying close attention to neighborhoods that have been hit harder than others by the coronavirus pandemic. That's the goal of the State Department of Public Health's new health equity metric, a third test that will decide in which of the pandemic tracking system's 4 tiers a county falls into, and which business and public sectors can reopen. The new measure, announced Wednesday, September 30th, will be checked alongside 2 existing metrics: rates of new cases and shares of tests that come back positive, which give state and county health officials a sense of the virus's speed and spread. To find California neighborhoods that are most likely to be disproportionately impacted by the pandemic and its economic consequences, the state health department will use the California Healthy Places Index, which considers socioeconomic hurdles, including race and ethnicity, income and access to health care, and expresses them as a score. Going forward, the test positivity rate among LA County's lowest scoring census tracts, largely low-income Latino neighborhoods where many can't work from home, have to be nearly in line with the county's overall positivity to drop to less restrictive tiers. Counties also must submit a plan that defines its most hardest-hit communities, calculates the percentage of COVID-19 cases among those communities and, by October 13th, share its plan to target the neighborhoods with more testing, contact tracing and outreach, among other strategies, to thwart the coronavirus. The state health department notes that census tracts that are home to about a quarter of Californians account for 40% of COVID-19 cases. The health equity metric, now one of 3 main bars that impart a county's pandemic performance, has been in the works for more than a month. The idea was first announced in late August, when the 4-tier system replaced the old county monitoring list. However, health officials won't know how L County's health equity score stacks up against other counties, and the state as a whole, until the new metric is included in the state's next weekly tier update on Tuesday, October 6th. Based on data presented in mid-September, the county had some improvements to make. "We're sorry that we have not made the progress we thought we would see when we look at rates of cases and deaths in areas with high rates of poverty," said L County Public Health Director Barbara Ferrer on September 23. "There is still a lot of work that needs to be done to close the gaps." Los Angeles County reported improvements recently in reducing disparities in coronavirus cases, hospitalizations and deaths among racial groups. While there were still inequities, the differences were smaller in September compared to the peak of the virus in July. Latinos were contracting the virus at rates 4 times that of whites and 5 times that of Asians. By Sept.